Standing idle, the robotic operating theatre at Southend Hospital in Essex. A third of consultants were missing from here today. Tomorrow they will be joined for the first time by junior doctors. Are you worried?
Yes, I am. I'm worried because the impact on our patients. We've seen high numbers of patients having to have their appointments rearranged. We've seen operations having to be cancelled, and we also know that the impact on the staff that are covering is increasing with no light at the end of the tunnel. The key concern that I have is that the NHS has run on discretionary effort of its staff, wanting to make a difference, wanting to do that, go that extra mile for our patients. But morale is really affected by this ongoing dispute.
This month alone, the Trust has cancelled 2,600 outpatient appointments and 420 operations. Across England, it's reached the 1 million mark, and it's cost the health service about £1 billion. Like hospitals across the country, Southend will tomorrow be providing Christmas Day cover. That means only emergency care. When you ring up the patients and say, I'm sorry, your operation's about to be cancelled, how are they taking it?
So far they have been receptive, because we normally try to contact them with an alternative date, and we try to fix them by additional capacities on Saturday list or extended evening. So that's how we are trying to amalgamate those gaps.
What do we want? Restoration! When do we want it? Now!
So a heavy reliance on goodwill, but there are signs of growing impatience, with warnings from Trust leaders over patient care and safety.
I don't think either side's going to win any more points, because people kind of get it now. I think the issue is, can they show a bit of creativity? Let's remember, at the beginning of this year, it felt like the nurses and paramedics strike was intractable, but a way was found to make progress on that. We need to show the same imagination now.
It is nearly 6 months since the Health Secretary and consultants leaders have met. He has said his door is always open, but he will not discuss pay. In fact, all he would discuss today was a consultation on introducing minimum staffing levels so doctors could be pulled in off the picket line. That is not likely to happen at the very earliest, even if it does happen at all, until next year. In a pooled interview in which we couldn't ask our own questions, Mr. Barclay explained why they were looking at this.
Well, it's right that we have a balance between the needs of patients to get time-critical services and the needs of people in terms of their right to strike. And what we saw in August was where NHS leaders locally agreed exemptions with BMA local representatives, the National BMA Committee refused to honour those exemptions. And that makes it very difficult for NHS managers to plan services. It makes it very disruptive for patients who need those time-critical services.
Channel 4 News has now learned that a meeting was held at the weekend between BMA consultants, leaders and government officials, but again with no discussion on pay.
Well, there's been some informal discussions happening over the last few days, which we hoped would lead to either a credible offer or indeed even a period of formal negotiations. But unfortunately, the government hasn't produced a credible offer. We're into the strike days now, and we want, of course, that position to change. None of us want the next strike days to go ahead. If we could have a credible offer ahead of those, then of course we would put that to the members with the view of calling off the action if that is accepted.
Junior doctors are calling for a 35% pay restoration, while the consultants are asking for an above-inflation pay rise and an independent pay review body free from what they say is political interference. Polling still shows support for the juniors, but less so for the consultants. Yet on the picket line today, they were clear about why they were still doing this.
I'll give you an example of my own department. We have a department where we should be 8 of us. Over the years, I have lost 2 of my colleagues to UAE. They have gone to Abu Dhabi. One of my colleagues has gone to New Zealand. And one of my colleagues, he's only in his 40s, had retired due to ill health and stress. And we are trying to recruit more colleagues, but we can't find them.
If tomorrow's strike action is being described as unprecedented, soon it could become the new norm. Juniors and consultants are planning joint strike action again for 3 days from the 2nd of October.
Well, joining me now is the Conservative MP Steve Barclay, who chairs the Health and Social Care Committee. Mr Barclay, thanks very much for joining us. Unprecedented, co-ordinated strike action tomorrow by junior doctors and consultants. Yet the Health Secretary's priority seems to be actually making it more difficult for doctors to strike rather than resuming talks. Is he right?
Well, I presume you're referring to the Minimum Service Levels Act. You know, that's an Act of Parliament that's been passed, heavily debated by both Houses of Parliament. We voted on it countless times. It's now passed into law. That's the principle of minimum service level. The Health Secretary now has a right, and I would argue a responsibility under the bill, to consult on what that means for doctors and nurses in the NHS. And that's what the government have put out there today, the launch of that consultation. And the reason it's newsworthy is because you do have this unprecedented strike action starting today.
And because he seems unwilling to talk to the consultants and the junior doctors about pay. 180 days since the government has talked to the consultants about pay, 140 days since the Health Secretary talked to junior doctors. Does that suggest a Health Secretary keen to end these strikes?
Well, I don't think that he's unwilling to talk to them. There are many, many things to talk about. There are many other issues. The pay issue, let's be clear, almost a 9% pay rise for junior doctors. Some will get over a 10% pay rise. Consultants have a 6% pay rise. You know, they are not unreasonable in the current fiscal situation. The Prime Minister was very clear that was the final offer.
Sorry to interrupt you. It is 180 days since the government talked to the consultants about pay, 140 days since the Health Secretary talked to junior doctors. Now, you may say there are other issues. I think the doctors would agree with that. But they want him to talk about pay. And if there are no talks about pay, these strikes just keep going.
Well, look, if they want to talk about a 35% pay rise, then there are no talks about pay. At some point, negotiations have to end. Now, I heard the consultants this morning talking about changes to the independent pay review body. We on the Select Committee would 100% agree with that. But what has to be fair to patients, to staff, and to the taxpayer is where we've landed with what I think is a fair and reasonable offer. But let's just remember, the NHS in England has never had more money. Fact. The number one ask of the BMA was pension reform, which has cost the government a lot. It's actually a tax break for some of the best paid people in our country. That has been delivered in the budget. And on top of that, just let me finish, you have a long-term workforce plan, which the last speaker in that piece was referring to the challenges of workforce, which was also one of the key asks of the health service and the unions.
And so you also, the NHS is also
unreasonable and inflexible.
OK, just to be clear, I suppose, to the public, who one assumes want these strikes to end, waiting lists soaring, you also have unprecedented coordinated strike action. Now, back in April, you called directly on the Prime Minister to take a leap of faith and for the government to resume talks to avert more strikes. Yet here we are. What is your message tonight?
Well, the Prime Minister listened exactly to that advice earlier this year, and he did resume talks, and I think he's landed on what is a fair and reasonable offer without repeating everything that I've just said. So there are many, many other things that do need discussing, and I know the door is open to them being discussed. The consultation on minimum service levels, look, all the conversations we've had around patient safety in recent weeks, I think it is not unreasonable for government ministers to try and secure what are safe staffing levels in the NHS over strike days because of what the Secretary of State said, derogations that the BMA are blocking on local level, even though local systems have agreed them. That is not
the
reasonable.
BM absolutely,
and I think any sensible minister would answer that.
They categorically refute that, but we'll have to end it there. Steve Barclay, thanks very much for talking to us. Thank you.